Hi, everyone, and good morning. I guess this is maybe one of the last times we'll get to say it, but Happy New Year. Thank you for taking the time to join us. We have moved on into 2024, but the public health emergency unwinding is still ongoing. Medicaid renewals are still being processed for Kentuckians, and then, across the whole country. So we appreciate you all taking the time to join us again this morning. We'll have updates on where we are from Senior Deputy Commissioner Veronica Judy Cecil. We'll have some more information about things that are changing and evolving and coming out from the in terms of guidance, et cetera, that we're keeping a pulse on and sharing with you all. And then we will have time for questions today. Got a couple from the registration, so we'll start there, but I encourage you all to use the chat. Throughout the session to flag any questions, and we'll backtrack to those when we have the time. And then last thing I will say is that in the days following today's session, the recording and the slides will be available on the PHE website. That's per usual, and all our past webinars are back there too, or up there too. So we'll make sure to put this there as well. But I think with that, we've got a great presentation for you today, and I think we can go ahead and get started, and I'll turn it over to you, Veronica.
Thanks, Helen. Welcome, everyone. I echo Helen's sentiment. Happy New Year. And just, I think throughout the stakeholder meetings each month, I mention this, but just would like to reiterate how much we appreciate your attendance, your interest in what's happening with unwinding the public health emergency. And in particular, what you may be doing to help Medicaid members navigate the restart of renewals. It can be challenging, especially since they were paused for 3 years. And some folks came in new to Medicaid during that period of time and have never experienced a renewal. So we again appreciate whether you're a provider, an advocate, maybe a friend or a family member of a Medicaid member, helping them understand what they need to do for their renewal in Medicaid. So I'm going to turn off my video while I go through the presentation, but we'll certainly come back on as we're going through questions. Okay, and as I mentioned, we always just level set the beginning of this presentation to say we are here talking about the unwinding of the public health emergency. Effective March 31st, 2023 is when federal legislation was passed to require states to restart those Medicaid renewals. We have pretty much every month talked about a potential new flexibility that we put into place. These are the ones that we've already mentioned, but that are the most recent that have happened in the last couple of months. Just to remind folks, we did redistribute December renewals, and what that means is that we still allowed renewals in December if someone was able to be passively renewed. By that, we go out and check the data sources that trusted data sources that allows us to verify all the information that's needed to make a determination of eligibility. And if we're able to do that, the member has to take no further action. We just go ahead and approve that member. If we can't, then we would normally drop that member to what we call an active renewal, meaning they would have to provide us some type of information or verification to proceed with the redetermination. So in December, what we did is go ahead and approve members that we could approve. And if we were unable to do that, we redistributed their case throughout the rest of the unwinding period. So those would have been redistributed across several months, not in particular month. The other thing to note is that we will still see terminations in December because we kept a renewal, a Medicaid renewal that was aligned to another program such as SNAP or TANF. We kept that renewal in December because the caseworker would only have to touch that case once because they're reviewing the case from all those different programs. So if a member was unable to be approved based on that redetermination, then you might still see terminations in December. You also will see terminations where we have not, we're not allowed to extend a renewal any further. So we implemented 2 flexibilities involving extensions. One was for long-term care and waiver members. We can extend their renewal up to 3 months past their renewal date if they haven't responded, so that we can continue outreach and encourage that member to file that renewal. We also, for the rest of the population, are able to extend them an additional month if they've not responded to a notice. So if a member's extension has exhausted in December, meaning we can no longer extend them, then they may be terminated if they did not respond to that notice. So even though we did redistribute December renewals, you're going to see approvals and terminations in December, although it is a smaller number for that reason. So the other thing I want to mention is, while we've not implemented any new flexibility since this was posted a couple months ago, the Centers for Medicare and Medicaid Services did issue an informational bulletin last month, allowing states to extend their flexibilities to December 31st, 2024. Our flexibilities have been tied to the public health emergency unwinding period, and therefore they would have had to end by the end of May. So now the state has the opportunity to continue those same, they're called E14 because it references the statute, the regulation that governs the CMS's authority to approve these flexibilities. So we can continue those for all renewals from May to December. So we are right now in the process of reviewing that and determining what we need to do to continue those flexibilities, but wanted to highlight that. And we'll put the link for that informational bulletin into the chat to share with you all. I think this is good news from the perspective that unwinding has been really difficult. We've implemented a lot of flexibilities to help with the workload and our workforce, and it also to benefit the member that is trying to navigate this process. So this allows us a little bit longer of an off-ramp with the renewals and being able to really focus on individuals that might have originally gotten the flexibility and are now going through a second renewal, helping them engage them even more in understanding the renewal process and what needs to be done to maintain their coverage. So we'll keep folks posted on what that really means going forward. But for now, just letting everyone know about this opportunity for us to extend flexibilities to December 31st, 2024. As usual, we've broken out the flexibilities that are specific to our 1915C home and community-based waivers. There are 6 of those, and those flexibilities we've been able to maintain in a different way. Our agency amended those 6 waivers and have submitted them to CMS. That allows us to maintain the flexibilities beyond what was their original termination date, which was November 11th. We will, as those waivers are being reviewed by CMS, we'll keep folks updated on what's the status. We did incorporate some flexibilities permanently, but as those get approved, we'll keep folks updated through what is kind of a separate update. And the link to that is in this presentation. We also provided for any member or provider in a home and community-based waiver, if you're trying to understand maybe the impact directly to you, we provided the email address and the phone number that you can call to ask about your specific situation. So as we anticipated at the beginning of unwinding, we continue to see a slight decline, which has slowed a little bit, but noticeable decline in the enrollment. I would like to note that we are still above the number that we originally entered into the public health emergency. We're a little over 1.5 million. And we started the public health emergency with over 1.6 million. So we're sorry, 1.3 million. So we are still maintaining an enrollment above that which we started. And noting that we are 8 months into the unwinding. So this is what we present every month that updates you all on the CMS monthly report that we've submitted to CMS and is posted on our website to report to CMS what the activities were involving the renewals for a particular month. So we now have December numbers, and looking there at the bottom, you see in December we did have 30,705 individuals that were up for renewal. We were able to approve 28,889 of those. That's a great approval rate. We did see terminations, 1,244, as I mentioned before, if we were no longer able to extend them, or if their renewal was tied to another program, then they may have been terminated for ineligibility. We have 2 cases pending from December, and for the extended, if they were previously extended and they had another extension available to them, we just continued to extend them. So we do have 570 folks, cases that are still in that extension period. So again, this just tracks the CMS monthly report each month that we submit to CMS. Oh, let me mention one other thing. So with the CMS reporting, the CMS submitted or issued updated reporting guidance and are now requiring states that are required to update their report for activities on pending actions, not extended, but pending actions that happen 90 days past the renewal month. So for example, for May, June, July, and August, we were required to submit by December 29th an updated monthly report for each of those months that reported activities for pending actions within 90 days. So for May, that meant we reported up to the end of August. So any pending case that we processed through the end of August, we updated the numbers on that monthly report and have submitted and have posted an updated May reporting period report. So for June, the same, that meant we reported through the end of September, September 30th, and have posted and submitted that report. Same for July and August. The September report and thereafter, states are to report by the 15th of the following month of the 90-day period. So for example, September, we were required to file that report by January 15th, updating any pending actions that were processed through the end of December. And this will roll through the rest of the unwinding period. So September's report will be due February 15th and so on. Sorry, October's report. So just a reminder, we do have a demographic report that we started with September renewals. So each month we're providing a report to look at the demographics of the individuals that are being approved or terminated from Medicaid. We do it by race, ethnicity, gender, and age. The report breaks down by county the approvals and terminated, so you can see the actual numbers at the county level in the full report. So recommend, if you're interested in this, to go out and look at our reports that are posted on our website. But it does allow us to make sure that we are, especially for children, making sure that, you know, any termination that is appearing, it highlights and allows us to dig into those a little further to make sure that children aren't being inappropriately terminated from the program. It also helps us focus on particular counties or areas where we might need to conduct some additional outreach if we're seeing a lot of terminations for procedural reasons. And by that, I mean they did not respond to a notice. And so we've been able to utilize the information for that purpose as well. So as part of the unwinding, we are able to offer a reinstatement period for individuals. If an individual terminates for lack of response to a notice, within 90 days of that termination date, they can provide the information, and if determined eligible, we will reinstate them back to the original termination date, as if there was no termination. There will be no gap in coverage. So this period of time is really important for our members who have gone through that termination for not responding. Maybe they missed the response because they moved. We've been unable to contact them through our outreach efforts. This allows us to get the folks back in, and they don't have to request reinstatement within this 90-day period. It's automatic. So we are tracking these because we want to compare these to the number of individuals that are procedurally terminated to see if we're able to get folks back in. As you see, we already are 391. We've been able to get back in November 2,668 and all the way back to October, over 4,500 reinstatements. This is particularly important, and I'll speak to this a little later in the presentation about what you can do for somebody that you know is in this 90-day reinstatement period. So our current outreach priorities really haven't changed since the beginning of the unwinding. We really want to make sure members respond to notices, even if they believe that they are no longer eligible. We'd like to have that actual determination of ineligibility because folks sometimes don't understand they may be eligible in a different type of assistance. They may be in a position to have a higher federal poverty level limit, and so their income limit may actually qualify if they just take the step to verify, which is can often be the reason why someone may lose their eligibility. Is we may be as we go out and ping that income information on the trusted data sources, it might show that they're ineligible, but in fact, they've had a change in circumstances and can notify us that by responding to the notice. That, as I mentioned, that reinstatement period is really important for folks to come in within that 90-day period. We're trying to make sure that some folks who have Medicaid eligibility because they're in a certain category. For example, if a member is receiving SSI, that makes them eligible for Medicaid. A former foster and a foster child is eligible for Medicaid. But if their circumstances change and they lose that eligibility, that category eligibility, they could be eligible in another way. So encouraging folks in these situations that receive a notice that reason, that category that granted them the eligibility is no longer valid, but they could still be eligible, just trying to make sure that they're interacting with the Medicaid eligibility workers to see if we can keep them covered some other way. And then, as we know, there are folks who are no longer eligible. And what we want to make sure is that they do have other coverage. So if they don't have employer-sponsored coverage, encouraging them to go out and choose a qualified health plan on Connect, the state-based marketplace. There are advanced premium tax credits available to them, often referred to as APTC, and other financial assistance that could make those plans premiums zero or very, very low cost. And there are also some opportunities for financial assistance for cost sharing. So making sure folks understand that if they have lost Medicaid because they've been determined ineligible, that there are other options, and connecting them to those to ensure no or a very small gap in their continued coverage. So we talk a lot about outreach, and the reason for that is because we're doing a lot of outreach. Since the beginning of the unwinding with the very first renewals in May of 2023, the state attempts to contact a member that has to respond to a request for information or to a renewal packet, which requires them to fill in information, send information, verify information. And so because they have to go through that active renewal, we try to reach them multiple times through that renewal period to make them aware of the fact to take action. So the state notifies a member about 90 days prior to their renewal date. We also send the actual written notice about 45 to 60 days prior to the renew date. We contact them again about 2 weeks following the date that their renewal was sent. And then we send another update around the 15th of the month of their renewal. And we continue to try to reach them until the end of the month to make sure they're aware that they are getting ready to terminate. For some folks, they don't respond because they know they're no longer eligible. But as I mentioned, it's always great for them to provide the information for a determination to actually happen. Well, while the state is doing that, in addition, the managed care organizations are doing that for their members. So each of the MCOs, and you see here listed the managed care organizations, they are also attempting to reach their members through various modes of communication to make them aware of that active renewal. We are also trying to reach the folks that where their income does show that they're above the Medicaid income limits, but they qualify for that qualified health plan and tax credit, to help them navigate how to go out and choose a plan that's right for them and to go through all the necessary steps that's required, because it is different than Medicaid in how you affect that coverage. So they have to choose a plan, they have to go out and make sure the premium is taken care of. So there are just additional steps that is very much unlike Medicaid that folks have to take. So our managed care organizations, in addition to the state, are really doing a lot of outreach to help folks. Just a reminder, we have a lot of information, flyers out there on our website that can be utilized by anyone. So the member can pull anything off, a family member, a friend, an advocate, or a provider. We encourage you, if you're really being proactive to help folks, is to go out and see the different types of information that's available for what we've attempted to do to address certain particular areas that we know may be challenging for the member. For example, the reinstatement, we have a brochure that's specific to reinstatement. So if you're a provider and a member walks in and you see that they just were terminated and they're in that 90-day period, then this would be a really great resource for that member to help them understand what action they can take. The same thing is for ID proofing. The far right, we have a fairly new flyer available We understood that a lot of members have difficulty creating an account for them on our Connect. Connect is into the resource where we can communicate with members who are going through renewal or applying for Medicaid. So sometimes there's difficulty creating an account because you have to go through ID proofing. And what we've done is provided information about if a member is having a challenge in a particular step with that ID proofing, what can you do to try to overcome that? So that's really great new information to provide to folks trying to create that account. The self-service portal is what it's called, and it really is a great way to communicate with the eligibility workers because you can upload information through your phone. You can take a picture of a document and send it that way. It's all secure. And then you've also have a way to track what has been provided. And it's also easier for the eligibility worker then to pull that document down and to process it. It's quicker than the mail, and sometimes things get lost in the mail. So it's a really great way to communicate on your application or renewal. So we do encourage members to have that. You can also utilize the self-service portal to update your contact information, which is critically important when we're trying to communicate with someone about their renewal or application. If we're unable to reach them to answer a question or to provide a document and they can't do it by the due date, then, unfortunately, we can't process that. We leave this on here also every month, just as a reminder for the various different ways that you can respond to a notice. So you can do it by mail or fax. You can go up, as I mentioned, onto Connect. You can call. Sometimes you can call in and a member can conduct their eligibility with DCBS on their hotline. Or if you have another question or need some assistance in navigating the process, calling Connect is another way to do that. And then we do across the state have connectors and insurance agents, and of course the DCBS, Department of Community-Based Services, local offices throughout the state. And a connector and insurance agent is another way for us to extend the capabilities of the DCBS office. Those connectors and insurance agents can help a member through the renewal, helping them understand what to do next, how to respond, how to provide documentation. They also, connectors and insurance agents, have an escalation process available to them so that when there are dire needs or particularly difficult cases that are having some challenges getting through the system, they can report those up through that escalation process. So we always do encourage folks, you have help available and to access that assistance throughout the state. We leave these on here just to remind, in case we have a new provider, that the role that you can play is really helping the member understand when their renewal is as they come in for an office visit. So on Kentucky HealthNet, which is a snapshot on the left side of the screen, that has the redetermination date, renewal date. Those are used interchangeably. It has the date that they were or are subject to a renewal. And so if you have a patient come in and you've checked eligibility and you see that renewal date is that month or the next month, it would really be helpful to notify them of that so that they can anticipate or expect notices to come. It's also a really great opportunity to ask them if their address has changed or their phone number or email address, or if they don't have one with the state, to add one. If they're changing the address for the provider or any contact information for the provider, that is also an opportunity to also change it with the state and to ask that question and maybe to help the member understand what to do to make that change. On the right side is the screenshot from our Kentucky level of care system clocks. Those are for long-term care and 1915C home and community-based services waiver providers. They're able to pull a report and see their patients' renewal dates through that system. So we do have, I mentioned the connectors, we have regular meetings with connectors in an effort to try to keep them updated on changes related to renewals and the Medicaid unwinding, and just to remind them about case escalation process, as well as talk through scenarios where we see trends. If several connectors are having the same issue with cases, then that's something that we want to make sure that we are resolving either at the system level, or maybe it's a policy or process change that's needed. So we are frequently talking with agents and connectors every month to make sure they've got the most update information. I always have to do a plug for our qualified health plan because it does impact Medicaid renewals. And as I mentioned, if they're ineligible for Medicaid, we'd love to see them move over to a qualified health plan if they don't have coverage through some other way. Right now, there is an open enrollment, and I should say there was. It closed on January 16th, and we probably did see, I think, one of the largest enrollments. I think we're finalizing the numbers, but we saw, and we're happy to see that there was a real increase in the number of individuals that have elected a qualified health plan. There is a anytime in QHP enrollment, there is always a special enrollment period for a qualifying life event. So we always encourage folks, if they find themselves in a situation where the open enrollment has closed, but they still want to enroll in a QHP, they should always reach out to double check and see if they can do it through a special enrollment. And during the public health emergency unwinding, there is a special enrollment for Medicaid individuals who have lost coverage. So anytime from March 31st, 2023 through July 31st, 2024, anytime during that period of time, a Medicaid member may have lost coverage due to being ineligible, they can go and elect a qualified health plan. And all they have to do is check the box that says they attest they lost their eligibility during this period of time. So if somebody, let's say, lost Medicaid eligibility in June or July last year, they can still, despite the fact that open enrollment has ended, they can still come in during the special enrollment period and get coverage through a qualified health plan. So here are our metrics. So you see 75,412, which is about 15,000 more than the number of members who enrolled in 2023. So really great to see that increase in coverage. Kentucky has a low uninsured rate, but we really would like to see our uninsured rate be 0 if possible. And as we saw Medicaid enrollment go down, we were seeing an increase in Medicaid enrollment going up. And so that's, again, the correlation we wanted to see between Medicaid and qualified health plan. So this is just the standard plug for our website, how to access it. Lots of information on there from for stakeholders, so advocates, providers, members. Please feel free to go out and take and check those out. The reports are on there, and these sessions are recorded and posted as well. And I always plug our social media. So if you're not following or haven't liked one of our social media, so Facebook, Twitter, or Instagram, you don't have to do all three, but if you do one of them, we share the same information across the three platforms. It's the fastest way and easiest way to stay up to date on what's happening with unwinding, especially if there's something we need to report quickly, like a scam that is identified, and we want to make sure everyone understands what's happening with that. Or last minute changes by CMS. It's a great way for us to stay in touch and to remind folks about what's happening with Medicaid renewals. You obviously know about the stakeholder meeting. You're here today, but we'll continue those through the rest of the unwinding period, and probably a couple of months following, just to keep folks updated on as we wrap up that first go around of renewals from the unwinding and from the public health emergency ending. And then lots of reports out there, the CMS monthly report, the demographic report, and then for providers, don't forget clocks and Kentucky Health Net. So we will stop sharing and turn video camera back on. And at this point, we're happy to take questions.
Yeah, thank you, Veronica. That was extremely helpful. I appreciate it. We have gotten a couple questions in during the meeting today. I do want to note, I did flag this in the chat that those reports referenced, we're working with our developers to make sure they're all posted and accessible. So they'll be on the website for sure if they're not there today. And then we did receive a question from the registration. So I want to start there since that, was kind of the first one. And that would be, it was specific to parent caregivers or family caregivers that were allowed during the PHE under the home and community-based programs. There was a question about whether that would continue to be allowed. And so I was wondering if you could speak to that.
Yes, so I think the short answer to that is yes. It will continue to be allowed. We allowed parent caregivers prior to the public health emergency, and we'll continue that beyond unwinding. And I do know that, as I mentioned, we did do some amendments to the waivers, and as those go through the process, we'll make sure that folks understand any changes that relates to that. But in general, the answer to that is yes, parent caregivers will be allowed to continue.
Great, thanks. We received another question for members whose December renewals were redistributed. Were they notified of that change to their renewal date?
Great question. Because we don't send the notice until after we go through and try to do the passive renewal, that ex parte is done at the beginning of the month before the renewal, then they aren't sent a notice yet. So they have not, they would not be aware of the fact that their renewal was up anyway. So they were not sent anything unless they were approved.
Great, thank you. We also received a question about whether or not it is known when the QHP selections and enrollment data will be public. I know that we're about 48 hours post-close or 36 hours post-close of the open enrollment date, but or timeline, but any sort of projection or idea of when that will be available?
I apologize. I do not have the answer to that question. But as you mentioned, Helen, I think because we do have the overall number, I'm sure that we'll be releasing more information soon.
Great. I haven't seen any other questions come in. I'm going to go ahead and scroll up just to check. But I think that we've covered those that have been sent in before. Before we either close out or wrap up, I want to make sure that people have a chance to type in their questions. So please feel free to do so here if you have one. We will, again, have this meeting in February to provide more updates. So it's not the last chance to get a question in, but just want to make sure that you have the time today if it's something on your mind. Okay, not seeing anything come through. Here is one actually from Priscilla. This is wondering when child renewals will restart.
Thanks for that question. So just to remind folks that starting in September last year, we had the flexibility that we were allowed to go ahead and move children 12 months and give them continuous coverage instead of putting them through a renewal. And so as the renewal came up, October, November, December, and through the unwinding period, instead of putting them through a renewal, we've gone ahead and extended them. So, so that'll be, rolling. So their first, potential active renewal, would be the following year. And because we, have been allowed and are being allowed to extend the E14 flexibilities, that certainly is something that we're going to look to do for those renewals that did not have the opportunity to be automatically extended for children through that the rest of this year, to give them that opportunity as well. So we'll try to keep folks updated on as that end of December comes up and what that's going to look like going forward. But unless the child turns 19 or moves out of state, or the parent or guardian requests that they be disenrolled, they will maintain continuous coverage even with a change in circumstance. For example, a household income increase.
Great, thank you. Appreciate that answer. Yeah, and December 2024 seems pretty far away, and I think it is at this point. It's about as far away as we can get, but it'll come before we know it.
Yeah, I think the other thing to note with that is what CMS I think is trying to do is give them some additional time to look at what of the flexibilities maybe that could be permanently put into place for the Medicaid program. States have asked CMS to think about that because a lot of states would like the opportunity to implement some of these more permanently. So we'll keep folks on updated on that.
Mm-hmm. Great, thank you. All right, haven't seen any more questions come in, so I think we can go ahead and wrap up for the day. Thank you, Senior Deputy Commissioner, for taking the time to present to us. We really appreciate these updates that we get every month. And thank you to everyone for taking the time to join us. Wouldn't be given updates if there was no audience for it. So appreciate you all being the audience and staying through this with us. So I hope everyone has a good rest of their Thursday and the rest of their week and is able to stay warm. I know there's some cold snaps going around, so stay inside and enjoy the warmth and the heat. So thank you all for being with us today, and we can go ahead and let you all free.
Thank you all.